Hi, this is Dr. Greg Baker with Life Touch Chiropractic in Chatsworth, and with me today is Lisa. She's been a patient of mine for about a month. And tell us what you initially came for.
Well, I had been having pain in the area I thought was my shoulder. I thought I'd pulled a muscle in my top of my shoulder right there, and it had just gotten worse and worse. And in about 2 weeks of dealing with it at home, I thought it was impacting what I was doing every day. It was so bad. So when I came to see you after the first visit, it was better. It was a step in the right direction. All the pain wasn't gone, but it was better.
And had you seen anybody else prior to coming to see me?
No.
What made you decide to try this first?
Because I wanted to start with the non-invasive first, because I figured if I went to my medical doctor, it would be a lot of tests and then possibly surgery. And I thought, if it comes to that, fine, but I want to start here first.
Sure.
And it's helped.
So your impression was it was more of a shoulder problem.
Yes.
And then during the course of my examination, I found some issues with your lower part of your neck. And this is probably the second most common condition that we see here. The most common is low back with sometimes affecting the sciatic nerve going down the leg. Second most common is lower neck issues, frequently with some kind of pain or symptom going into the shoulder or down into the arm or hand. And so a very common thing, we see it all the time. And I can very often just predict that it's going to be a spine-related issue just based on the symptoms that you tell me. But of course, we do the exam to confirm that. And then the final confirmation is the fact that it was getting better, especially got better right after that first treatment. So you've been coming in just under a month now, and what % better would you say it is now?
Oh, the pain's completely gone. And like you say, before I actually came in, it started in the shoulder, but it had radiated down. It was pain in the elbow and everything there too. But the pain's completely gone. There's some aggravating symptoms, maybe a little numbness or tingling, but that's getting better too.
Typically these kinds of problems get better in somewhere between 2 to 6 weeks. So you're right on track. So we got a little bit more work to do, but I don't see any reason why you're not going to get fully recovered from it.
Oh, I'm thrilled. I mean, it's just so much because I can do what I want to do now. And I was sitting in a recliner just thinking, when's this going to get better?
Great.
So
well, I'm glad we were able to help you, and we look forward to finishing up with you. Thanks again. This is Dr. Greg Baker with Life Touch Chiropractic in Chatsworth.